Hello friends, myself Dr. Yashica Rathore, consultant Obs Gynae at Supreme Hospital, Surajkot. Today we will be talking about ultrasounds in pregnancy. Many patients come to me and ask me, ma'am, how many ultrasounds do we have to get during pregnancy? Is it necessary to get these ultrasounds done? And are they safe for an unborn baby? So, see how many ultrasound we have to do during pregnancy. At least we do 3 to 4 ultrasounds during pregnancy, and if you have normal pregnancy, and if you have complications during pregnancy, you have high risk pregnancy, and if there are multiple pregnancies, then this number of ultrasounds can be increased. So let's see the important ultrasounds during pregnancy. First is ultrasound early pregnancy. This is usually done at 6 to 8 weeks of pregnancy, that is 1.5 to 2 months of pregnancy. In this ultrasound, we see for the cardiac activity of the baby. It usually confirms the pregnancy. We see for the localization of pregnancy, whether it's uterine pregnancy or extrauterine pregnancy. That is, whether it's inside the uterus or the pregnancy is the tubal pregnancy. We also see for the gestation, like it's single or you have multiple fetuses. Then we come to another ultrasound, that is NT&B scan or nuchal translucency and nasal bone scan, usually done at 3rd month of pregnancy between 11 weeks to 13 plus 6 weeks of pregnancy. In this scan, we usually see the structural things of baby from tip to toe. We see for the nasal bone, we see for the fluid that is behind the neck of the baby, and we measure it. This test ultrasound is usually combined with a blood test known as double marker, and this ruled out the congenital anomaly in the baby. We also see for the Doppler indices, that is blood flow to the uterus, in order to see for upcomings, intrauterine growth restrictions in baby, and hyper disorder during pregnancy. We come to next ultrasound, also known as level 2 ultrasound, TIFA, or also known as anomaly scan. This scan is usually done at 5th month of pregnancy, that is 18 to 20 weeks of pregnancy. Already we have got the NT&B scan done. So this is the detailed scan of NT&B, and we see for the structural deformity of the baby in this scan. Every deformity, major deformities have been ruled out in this particular scan. This scan is also combined with Doppler studies, that is blood flow to the uterus, in order to see for intrauterine growth restrictions and hypertensive disorders in pregnancy. The last scan that we do is in the 8th month of pregnancy, and usually between 32 to 34 weeks of pregnancy. Already we have seen that structurally a baby is fine. Now we want to see the growth parameters of the baby. In the growth parameters of the baby, we see for the dimensions of baby, we see for the weight of the baby, the placental localization, AFI, that is Leica around the baby, and the blood flow to the baby. After seeing this, if everything is fine, we don't want to repeat the ultrasound. If there are certain complications, if there is decreased flow, if the Leica is less, the parameters are deranged, then we have to get an ultrasound after 4 weeks to see whether the things are going fine or not. So thank you. If you have any query regarding ultrasounds during pregnancy and queries related to pregnancy, follow up at Supreme Hospital, Surajkot.